Hello and welcome to Visionary Voices, powered by Optimum Healthcare IT, our conversational thought leadership podcast where digital and technology healthcare leaders come to talk about their latest transformations, their latest innovations, and successes at their organizations. I'm your host, Larry Kaiser, Chief Marketing Officer at Optimum Healthcare IT, and I'm excited to bring a season of new leaders, new ideas, and new conversations with people shaping the future of our industry to you, our listeners. And with that, let's dive in. Hello and welcome to this episode of Visionary Voices. Today we welcome Carol Davis Smith from Carol Davis Smith and Associates and Matt Baretich from Baretich Engineering. On this episode of the podcast, we're going to be discussing the then, the now, and the future of HTM, aka Healthcare Technology Management. The conversation today will be led by Optimum's Principal ServiceNow Advisory Consultant, Shelby Johns. Welcome to the show, everybody. Hope you're having a good day.
Thank you.
Glad to
Thanks
be
for
here.
inviting us.
Thanks, Larry.
Thank you. All right, so today we're gonna jump right in with one of my favorite segments of our podcast, which we like to call Bandwidth Banter, which is our fun take on icebreakers and allows our listeners to get a little bit of a better understanding of who they're listening to on here. So I'm gonna direct my first question to Matt. Matt, I've heard you're an aficionado when it comes to coffee or tea. So what is your go-to coffee or tea drink order?
Oh, my order is Twining's green tea with jasmine flavoring.
Oh,
So
that's a good one. That's a good one. I enjoy
I
that
don't
one.
know. Well, good.
And
Good.
if you go somewhere and they don't have it, you need a backup. Are you going tea again, or are you going coffee?
Oh no, I go latte, decaf, no low fat milk, and artificial sweetener. It's like, why bother?
All right. Well, there you go. There's if anybody wants to buy Matt a coffee or a tea, you know what the man likes. All right, Carol, you have some background there that kind of leads me to this one. What's your favorite sports team?
So that's a tough one. I am probably more aptly described as a sports aficionado. I grew up. I always tell people that was my first job was playing sports. I went to school and I played sports all season. But I'm a huge basketball fan. Spent my formative years, wasn't born there, but spent my formative years in Kentucky. And you pretty much have to learn to like basketball if you're not born with one in your hands. And recently, my mom was asking me, "Well, who are you rooting for in the March Madness?" And I said, "That's really tough because I'm of a vintage, if you will, that I tend to root more for coaches, people that were my contemporaries or came shortly after me that have really taken the program and women's athletics forward. So I'm a huge Don Staley fan. Yeah, exactly. So I'm a huge Don Staley fan. But I also have a bit of affection for the Yukon Husky women. Gino could just make me crazy some days, but the man, along with people like Pat Summit, really opened doors and kept them open for women going forward. And the Yukon players always put on a good show. Rough March Madness for them, but it was they put on a good show. So, and now I'm very excited because WNBA has started. We've had the preseason games and we're back on the court. So, had my 3 weeks off and I'm right back in it.
Well, I find it interesting you mentioned the coaches. When I was in high school, I went my junior and senior year. I was in it was called the Coalition for Essential Schools, and it was a school program founded by a gentleman by the name of Ted Sizer. But in order to graduate, you had to do what was called a senior project. And in the senior project, you had to prove that you have new knowledge of the topic in which you are presenting on. And then you have to pick a teacher in the school, and they're your mentor. So I actually chose our athletic director, and the topic I chose was player-coach relationships in the sport of basketball. And he had connections all over. He got me into various colleges, University of New Hampshire, because I went to school in New Hampshire. But ultimately he got me 2 weeks at Brandeis University with the Celtics every day for like 5-6 hours for practice. And I sent the highlight of the story is I sent a survey out to all of the head coaches in the NBA looking to have them answer 5 questions. And I still have some of them, but I have like a response from Phil Jackson. I had a response from Don Nelson. I had a response from Pat Riley because I used his book as the basis for my project, his autobiography. But I also got job rejections and various other entertaining responses back from that. And then when I was in high school, after I aged out of recreation, I coached basketball. So I actually coached a girls' recreation team to a championship, I believe my senior year in high school. Ironically enough, a person on that team, her name was Courtney Banghart. She is the head coach now of the UNC women's basketball team, and she came up underneath Pat Summit.
Wow.
There you go.
So,
There you go.
so I would
Hey,
like
and
to add a little.
Shelby, I'll let you know softball championships are starting up in another couple of weeks, so no shortage of women's athletics.
No, there's
For
not.
sure.
And Arkansas softball's up there.
That's right. I noticed that.
So Shelby, what's your go-to sports team?
Well, when Carol was talking about Kentucky, I thought she was gonna say the former men's basketball coach, Coach Cap, who is now the Arkansas men's basketball coach. So I'm originally from Arkansas and I bleed red and I love all Arkansas sports.
Very cool. Well, I might have we might have to add a tag to this podcast wherever we're posting it to include not just business and HTM, but also sports. There's a really entertaining sports conversation here. So I appreciate all the little fine conversations here, and thank you for sharing a little bit about your personal life with our listeners. But with that said, I think it's time to dive into our discussion. So Shelby, the mic is yours. Take it away, and I'm looking forward to this interview.
Thank you, Larry. All right, in honor of Healthcare Technology Management Week, we are excited to talk about the then, now, and future of HTM. So I'm going to start with a then question for Carol and Matt. Looking back over the last decade, what are the most significant shifts you've seen in how HTM is measured and valued within healthcare organizations? Whoever feels like they want to start first.
I'll jump in because I'm all about measurement and the what has we've had different sorts of measurements over for a long time. Some of them are just basic things like, did you get your PMs done on time? And that's because the Joint Commission, for example, required you to report that. What has been happening more recently is a lot more in the literature and in practice to come up with some more sophisticated metrics. And coincides with the development of more sophisticated CMMS products that can generate that kind of information. Where I think we have not progressed as far as I had hoped over that time is in standardizing how we measure things. There's still, I see a lot of variation from one organization to another. And Carol will probably talk about this, have both been involved in doing some standardization efforts to standardize some of these metrics. And then I follow up and call people and say, are you using this new white paper from Amy, for example? And they say, yeah, but we changed it a little bit here and we added something over there. And what gets lost in that transition is if you don't have really actual standard ways of measuring things, you can't do benchmarking. I can't compare my program to yours and learn anything from yours because the numbers don't jive.
Yeah, for sure. I was just talking with a client today that has an independent service organization. I was like, well, did they implement Amy's failure codes yet? And they were like, no. And I was like, well, we'll see how we can map them to the Amy failure codes.
Yeah,
That's right.
excuse me, totally agree with everything Matt said, and it is a bit frustrating we haven't seen that uptake. But I want to look at it from a little bit different angle. When you asked about how is HTM valued in the last decade, or maybe a little more, we've seen more executive level positions for HTM leaders. And
Mhm.
so I kind of see these two things in contrast, if you will. Apologies, allergies. Um, but we have people sitting in executive director and VP level roles. Yet, as Matt said, some of these standards or the effort to standardize has not happened. And so that to me, that's a bit of a question where our health systems say that what we are doing is valuable enough to have an executive level management and leadership, yet we still haven't quite got on the boat of what that means, both strategically and tactically. So I find that interesting. I don't have a good explanation for it, um, but I think that's something worth watching and maybe addressing.
Yeah, no, I think that's a very valid point. Many HTM departments are handling capital equipment nowadays and getting multi-million-dollar budgets to spend on things like service and new equipment. So we need to make sure we have the data to back those decisions up. Um, So today, how central is data to HTM decision making? Where do most organizations struggle to make that data usable rather than just available? I think you guys hit on it a little bit more, but wanted to know if there's anything else you wanted to add around data today.
Well, I'll say one angle on that question is because I know in your audience you have more than HTM professionals, and so um, many of the people that we work with in the organization as peers or up in the organizational structure don't know the details. They're looking for understandable metrics that provide some genuine management, actionable management information. And I don't think we're getting very good. We're doing very good at that. Um, and I think that's a key thing for the value and the recognition of HTM and just the profession in general is to um, is to realize that's who our audience is, if you will. The people that need to hear that, need to understand, need to be able to get a quick picture of what's going on. As my interaction with the executive level is that they're sort of scanning around to say, are there any problems out here on the horizon? And if we can convincingly and truthfully say we don't have problems in our area, that's important. But if there is a problem, we should know it. We should know it ahead of time, and we should tell the people that need to hear it.
Yeah, I think KPIs is a common term we like to use for those key performance indicators that executives want to keep an eye on. But you also have to have KPIs in place in firstly to track them. If not, then you're staring into an unknown of if there is issues you don't know about them.
Yeah, yeah, absolutely. And I think Matt's alluding a lot to the operational pieces, which we should be doing a lot better. I mean, we've been measuring these things for decades, not just the last decade, but 2 or 3 or 4 decades, right? So we really, I think that's an audience, as Matt said, I think that's an audience thing. But also looking at a couple of other areas strategically, you mentioned capital planning, which of course is one of my favorite swim lanes. Um, Again, being able to be proactive. Just recently, and this seems to be sort of an ebb and flow thing. Recently, I've seen more interest in being proactive, forecasting out 2, 3, 5 years. In some cases, 10 years. Obviously, that's pretty fuzzy crystal ball, but the point being looking ahead, anticipating, and trying to align it with construction. But my fear is that the economics of healthcare, the constraint of funds, will have people sort of throw their hands up and say, "Well, why bother? We don't have any capital anyway." Which just keeps putting us back in this do loop of we have no capital, why plan? Oh my gosh, look, we have money. What do we spend it on? And we run around and react, right? And so it's the squeaky wheel, the loud voice, the person stomping their feet. So I think we've got to me, that's a leadership challenge. And this goes back to my earlier comment. If we're going to have executive level management and leadership, we need to extend that, those behaviors. We need to exercise those behaviors at a higher level. And then the other example that I've been working on recently is staffing. And actually, probably the last 4 or 5 years, I've had a few projects this way where, we all know, oh my gosh, we have a staffing shortage. I need more people. My response to that has been both when I was in a healthcare organization and now in my consulting role is okay, what kind of people? I think it's the more difficult question to answer is what kind of people do you need? We need the right people doing the right work. And so data, if you will, on our staff, understanding who knows what. When I've engaged with healthcare organizations, training records or paper files or a certificate the tech has on their phone or shoved in a drawer or a spreadsheet that says has an X or a check mark, but there's no context or qualitative or did that expire or whatnot sort of information. And so our ability to manage the devices, yes, manage our messaging up to our true audience, yes. But let's not forget about our most important resource. It's not service contracts, it's not safety analyzers, it's the technicians and the engineers that work on our teams and understanding what skill sets they have. And are we getting the most are we allowing them to practice at top of their license, as our nursing and physician colleagues would say? Are we enabling that? Do we even know what top of license looks like? And I think this is an area that we're going to have to get better at because it's not like people are coming out of the woodwork. We have to keep doing what we're doing to promote the field, but I think we need to understand the tools that we already have, the people, the resources we already have.
Yeah, so Carol, I'm going to follow up on some of that. I agree with everything you have said, but if you follow the different HTM podcasts, for example, and the hot topic for years and years and years is that we don't have enough qualified people, and the ones we have, the qualified ones, are getting old and they're retiring, and I'll put my hand up for that. And so how are we going to get some more people? How are we going to get some more good people in here? And we've been saying that same thing for a long time, and we do some good things, promote the field. We introduce it early in schools, and all that is good stuff. But I haven't seen much progress with that, and I'm not sure the solution to that. We don't have the people to do what we want to do is being solved by this on the supply side. And I know you've thought hard about staffing, and I wonder what your take is on it. Is that I mean, how do we change that conversation to something that's likely to be more productive?
I, not to interject too much, but I was just at MD Expo in Baltimore, and the Children's Wisconsin team did a Women in HTM panel where Anne talked about hiring three female techs in the past few years, and she highlighted that I think it was around she replaced about 153 years of experience with 9 years of experience. So I cannot emphasize enough that I think there is a shift in younger people coming in and wanting to be involved in this field, but departments need to be invested in training them and getting them up to speed on what they know, and it's going away from a lot of these biomed schools and into the shops in the basement of hospitals.
Yeah, I would agree. I think there is a huge opportunity for cross training. We've done it informally again for decades. The techs even did cross training with me as an engineer. But I think putting some structure around that and not just as a manager expecting it to happen, or assuming it's happening. I think we have to put some structure to it. And yeah, I see job descriptions that say fix stuff, for all intents and purposes. They're more focused on fix stuff in this building kind of thing. And I think having an inventory, so to speak, of skills that we have and skills that we need based on what are we responsible for. And so, kind of back to earlier comments about data, do we have a complete inventory? Do we have an inventory? Do we know enough about what's in the inventory? Small, medium, and large CT, small, medium, and large patient monitors, those sorts of things. Do we have the right skill set? And to the point about Anne replacing 150 years of experience with 9 years, I think quantity is helpful, but this is very much a quality. What was the quality of that experience? Was it the same thing for all those
Three very
years?
quality techs is what came out of it. So,
Right, right. And what is the current skill set need? What do we not have to do anymore? Which I think Matt's alluding to because he and I have that conversation a lot. Like, why are you still doing that? One, the technology doesn't need it. Two, the regulations don't call for it. Three, you don't got time for it. Right? Um, and and the first two make it not even a nice to have, it's a don't need to have kind of thing, right? And so I think I just don't see the structure there. We'll put hours into um, pressing for PM completion, but we haven't really looked at, is that PM completion, does it make sense? Like what we're doing for an NRPM program? Do we have the
That's
right
right.
skill set? And the thing that makes me completely insane is when we don't meet PM completion because we're not managing our vendor. That's another skill set. And I don't think we as the HCM community don't always recognize that we need those sorts of skills. How do you manage a business partner? How do you manage a service contract? How do you evaluate one? Because it's a mix. There is no insourcing, outsourcing. It's the right mix of insourcing and outsourcing, right? So I think I don't have all the answers to fixing the staffing issue. I just think that we keep saying I don't have enough people, hoping that people will show up at our door. And I agree, Matt. They're not. They're not going to show up at the door.
Right.
We have to figure out what are the skills we need, and can we get them from different types of people, and then train them. The thing that always scared me in the past was, well, let's just go get a auto mechanic and a electronics tech and throw them in. And quite honestly, that's dangerous for both the organization and that individual, right? Let's bring people on with an onboarding, with a training plan, with a program, not just throw people in the deep end of the pool and hope they can swim.
it sounds like the first step should be documenting your skills of your workforce, technical and soft skills, and then using that data to justify new FTEs and what exactly in that job description it needs to be tailored to.
Echoed,
That's
yes.
yeah, yeah.
We're
That's a big
fixing it
part of
right
it.
here, everyone.
Well, yeah, absolutely have to do that. And but if there's nobody out there, we're just going to have to steal from each other, you know.
Mhm.
I have a better recruiting program. I don't know, better lunchroom, something like that, you know. So come and work for me. And that's not a comprehensive kind of solution for the HTM community. And I don't know. I think this kind of theme will come up again as we go through this conversation today.
Yeah, yeah. Going back to data and since a lot of Optimum's audience here is executives, what KPIs or reporting analytics should these executives go back to their HTM departments and ask them for? How are you tracking things more than just PM compliance?
Mm. Uh, uh, it'd take me a bit to come up with a list, but what I want to make a pitch for is having sort of compensating metrics, compensating KPIs, meaning, um, for example, you can get your PMs done on time if you do slapdash PMs. So you want to have something about getting the PMs done and something about the quality of the PMs that you do, which would be failure codes or repeat repairs or things like that. So that if you don't have those compensating factors, it's easy to game the system. It's like productivity numbers. People want to see there's a certain number of hours in the day that get recorded as doing something useful. Well, if that's the only KPI that say your staff are rated on, they're going to find lots of things to write into the CMMS about what they've been doing. And that's not the same as being busy on useful things. That's gaming the metrics.
Yeah.
Yes, I would echo that substantially. And I'm going to go back to the leadership piece in our community and communities at large, um, is like the whole idea of productivity. I think we've gone after it in a way that just undermines itself, so to speak. Um, as a manager, I have always been more interested in where is my staff having to spend their time. And maybe this is somewhat geographically driven because I've lived in areas where there were bottlenecks. And I've almost always been associated with a reasonably large health system. And so as you try to get from one location to another, windshield time is real, and there's no getting around it in most circumstances. That's not the technician or engineer's fault. That's the civil engineers that designed the city. But it's a design constraint,
We'll
right?
blame another engineer.
That's right. Um, but I, my job as a manager is not to press for, I want to make sure you're only spending your time on productive hours. My job should be, I want to understand where you have to spend your hours. And if you have a whole bunch of hours that are spent just trying to get from point A to point B, then let's sit down and have a conversation and figure out how to manage that. That's a totally different conversation. It's a strategic
Okay.
conversation as opposed to a disciplinary or a punitive or a tactical conversation.
Yeah,
And so I
absolutely.
think wrapping our head that way. And
Yeah.
another one is to Matt's point about quality. I was recently, and by recent I mean in the last year, was in a couple of conversations with imaging department directors, the clinical side, who were sharing that they are being asked to provide visibility into the impact or the outcome of their services, as in patient outcomes. Did they have to do repeat scans? Did the patient progress to treatment? Was something they did, or because equipment wasn't available, the patient had to be rescheduled or diverted to someplace else or whatnot? And I think that really struck with me, um, and resonated because I thought we need to somehow figure out how to make that alignment. And it's probably not on our own. It's probably in collaboration with our clinical partners, because we don't always directly know, right? But having just because the equipment down, that may or may not have resulted in of patient outcome, good or bad,
Mhm.
right? But it probably did.
Yeah. I think there's another place that we could talk about the standardizing metrics, because if I go to my boss and say, here are my numbers for this month, and the next question is going to be, well, how do those compare to the hospital down the street that we're
Mhm.
competing with?
Mhm.
And if we say, well, um, we don't calculate that the same way. or I don't really know the answer. It's an unknowable thing. Just trust me. No, that's not going to fly. So it's another reason to. So we can put, back to your question, Shelby, we could put together a list of the top 10 metrics. Um, and uh, but these other issues that Carol's brought up and you've brought up some examples uh, are, I think, even bigger questions with that ultimate objective of actionable management information. In other words, out of all these KPIs and all the numbers, do we know what to do to get better? And that's the key question.
Right.
Yeah.
And that's not one size fits all. I
No.
mean, Matt, you and I have worked enough projects together, and Shelby, when we kind of worked together, we had the intern cohort and all that. We saw every hospital is exactly the same and completely different,
Yeah.
right? And so I am in lockstep with Matt in terms of how we calculate things needs to be consistent. But the metrics and the KPIs I need for my health system are likely to be at least somewhat different than what you need at your place, right? And that's okay, because the more we overlap, we can actually compare and contrast. It's not everybody has to measure these 10 things, because
Yeah.
maybe only six of them really apply to me.
Yeah. It sounds
Yeah,
like each organization needs to sit down with their leadership and say, this is where we want to improve. How do we measure that?
yeah. I remember talking to a joint commission surveyor, or a senior one, and he was describing a situation where he was asking some HTM professional about some metric. I don't remember what it was. And that person brought it forward and said, look at this. We're always at 99, 100% to 95%. And the advice that the surveyor says, stop measuring that because you got that under control. Go measure something where you are not doing well and figure out how to improve it. And that's the trap we can fall into. We want to show good numbers to our bosses,
Yeah.
but we don't want to fool the bosses, and we certainly don't want to fool ourselves.
Yeah. Yeah. Well said. One last question about the now. What are the small but meaningful changes HTM teams are making today that to like move in a direction of progress beyond basic compliance and towards a higher maturity as a department?
Mhm. Mhm.
Well, I'm going to jump up and say, when I came into this field 30 some years ago, the loud voices in the room were the clinical engineers that were my mentors. And the technician world was separate for whatever, had their issues, whatnot. But I would say in the last 5 years or so, I have been very pleased to see, and maybe it's just a generational change, but I've seen the technicians stand up and not ask who's going to do something for me, but to say, here's what I'm doing for the community. I'm building foundations. I'm building training resources. Helping people find jobs. Whatever. It's self-help, right? It's like, here's my problem and I'm gonna find a way to solve it. And um, I feel like I've always had, and I think this goes back to the sports conversation we had at the very beginning. I grew up playing team sports. I don't know how to not work in a team environment. Um, and so it always was a little heartache of mine to feel that there was this gap, or this separation, if you will, perceived, real, whatever. And I really feel less and less of that. Like, some of the people that I get the immediate "Hey, Carol" from are the technicians, right? And the partnering, and the friendships and the professional learning I get from them and share with them and whatnot, it just feels like culturally we're getting over what I'll call the stupid stuff, and recognizing that this is a team sport, right? I mean, just the other day I had a conversation with um, a technician that I've met in the last year. He is fabulous, and we had a conversation about partnering and partnership and whatnot, and I thanked him. I said, "Thank you for letting me be the second base to your shortstop." Right? Because we're so much more effective now. We can do so many more things because we're collaborating and not worried about turf and status and whatnot. It's like we got a job to do and let's do it together because we'll get it done faster and better. So for me, that's a change I'm seeing in the last few years.
Nice. Matt, anything quickly to add or?
No, I think Carol's got it exactly right. I'm starting to think about the future, and I think the future is going back to what we were talking about earlier with staffing and getting people in for the jobs. The future is going to be continuing to do that. And the examples Carol was talking about, there's some really proactive, amazing, creative people who are not waiting for someone else to recognize them. They're going to say, we're gonna improve our profession and make it work. But I think the other side of the coin is what we need to work on going forward in the future is to say, I don't think we're going to solve the supply side of getting more techs in that are the right match. We should do everything we can to match them up, but it's just not going to be that many more people in the pipeline. I think that where we go forward from here is how we deploy the resources that we've got. And it's been all through my career as a consultant, I've spent time um, working with doing HTM program assessments, for example. And Carol has done those on her own, and we've worked on some of them together. And what I've always seen is there are ways to make better use of the resources that we do have available, the human resources and the culture and the money and the machines and the test, all the stuff. And we, I think that's where the solution is going to lie. So if we're just talking pure productivity, yes, we need more technicians, and yes, they need to have the skills that match the equipment that needs to be taken care of. But are we implementing an AEM program to stop doing stupid stuff? Someday I'm going to have I keep promising I'm going to have a t-shirt made. Stop doing stupid stuff. We do a lot of dumb stuff.
I've
Um,
pre-ordered mine.
Yeah,
all
we'll
right.
wear it to Amy together.
Okay. Electrical safety testing that hasn't been required since 2012. There's a ton of stuff that we can stop doing. And if you run the numbers, even with conservative calculations, it translates into a bunch of FTEs that appeared out of nowhere.
Mhm.
So I think, I don't know. I'll say my last cliche. The other thing I sometimes say to people, we got to think outside the basement and start thinking about these big picture things for our own sake, for our boss's sake, because that's what they care about, and start looking at some of these issues globally. And it touches on everything that Carol has said today, a global view of how we get better.
Well said.
Yeah, I think that
Amen.
I think that's a really good point, and I think that's a great point to end this conversation by saying stop doing stupid stuff. I will happily take one of those shirts as well. I can tell you, um, over my 22 years in healthcare IT, I've seen plenty of stupid stuff. Um, but yeah, I think that's a great way to end this conversation. I really do appreciate everybody's opinions and insights here today. So I want to thank our guests, Carol Dale Smith and Matt Baretich and Shelby Johns, for sharing their insights. Real quick, any last insights that can stop doing stupid stuff? Any more cliches or anything like that? All right. Well, thank you everybody for joining us. And to our listeners, thank you for tuning in to this episode of Visionary Voices powered by Optimum Healthcare IT. And remember that the future of healthcare IT starts with your vision. We'll catch you next time on Visionary Voices.